Hello everyone, my name is Dr. Keith Forwith with Advanced ENT and Allergy. This week we're going to answer some questions on video that you've sent in by Facebook and by email. On this episode we'll discuss thyroid symptoms, traveling with ear infections, and inheriting thyroid disorders.
Is it okay to travel with an ear infection?
So traveling with an ear infection can be a little bit tricky. If you're driving by car, it should be a whole lot better than if you're flying by plane, mainly because altitude is the thing that can really get to people's ears. Now, if the ear is completely full of fluid, you shouldn't have too much trouble, but if it's a mixture of fluid and air, the pressure changes from altitude may really get to an ear and make it hurt even worse, especially in a child that may be very uncomfortable while the altitude is changing. There is a video that you can look at. It has a little more description. It's called Flying with a Cold, and you can access that by following the link below.
Is swelling in my clavicle and neck pain a sign of a thyroid problem?
Anytime when we see swelling, particularly in the central part of the neck near the clavicles, it raises a concern for whether or not in fact there is a thyroid problem. If we feel something that feels like a lump or an enlarged thyroid, our first step is to get an ultrasound, something we can do right here in the office. Very painless and easy to do, and probably the best way to evaluate something near the clavicles in the central part of the neck. If it's out in the lateral part of the clavicles, probably not related to the thyroid, but yet still worth checking out for sure. Could be something very simple or something more complex, and we can evaluate that right here in the office with an easy, painless ultrasound.
My mother had a thyroid disorder. Will I inherit this?
So this is a complex question, but a very good question. And it depends on what your mother had as to whether or not there can be an inheritance. Certainly we see things like Hashimoto's, which is the most common thyroid disorder in America, and we do seem to tend to see that in families. It can occur sporadically as well, but definitely if your mom has a problem, you may have a similar problem with the thyroid as well. While most thyroid cancers are not family related, we do see that some families do have something in their gene pool that leads people to be susceptible, and we've seen family members extensively with thyroid cancer. Certainly a history of thyroid cancer in your family puts you at an increased risk and definitely raises the suspicion during an evaluation if there's something that we find wrong with the thyroid or a lump in the neck or anything like that. A family history would definitely cause us to evaluate more carefully with a family history. If there's no family history, you can still have sporadic things that happen with the thyroid, and we'd be happy to talk over those as well.